she publicly posted on Instagram last week, I think, that she had suffered from a condition that we call paradoxical adipose hyperplasia. So PAH, or paradoxical adipose hyperplasia, it's a bit of a mouthful. What it means is paradoxical is that like the opposite to what you expect. So it's the unexpected reverse reaction. Adipose is fat, and hyperplasia means increase or growth. So it basically just means unexpected fat growth.
What is the frequency of PAH occurring? What studies do we have globally? What studies do we have locally? And have you ever experienced it in your practice?
So we don't have cryolipolysis in our practice. So, I want to put that out there, that although I obviously know a bit about it, we don't perform it. So I don't have any firsthand experience of this complication in my patients. The statistics are variable, as with many of these kind of fairly rare complications. The early studies were suggesting that it was about 1 in 4,000 people, which is very, very low. But some more recent studies and practice analysis have shown a rate of up to 1 in 138 or so.
Yeah, that's what I've read, which is quite
0.7%. Yeah, so I mean, you could say less than 1%, less than 1 in 100. But certainly from a practitioner point of view, that would be something that I would want my patients to know about and accept the risk of before they went ahead. And of course, as you said, if it's effective, it's very effective. So, people, it might not put people off, but it might mean they go more slowly, they do it a smaller area to test it, or something along those lines.
The real experts, such as yourself, such as the formulators, such as the surgeons, there needs to be a collective, safe, reliable forum for consumers to come to. And media is really hard. It's really hard for a normal person to get this information. So where do you go? What do you suggest? Other than Ageless, of course.
Yeah, Ageless, of course. I completely agree with you. And this is why I'm in this space, because it's very, very frustrating as someone who does have expertise and experience and knowledge and education to see where people are getting their information from. It is so depressing that the misinformation out there is being fed to people through, media, influencers, TikTok, people's friends, the number of people that, choose their skincare based on a TikTok trend or a friend's advice. I mean, even that, if you think about it, no wonder people are wasting billions of dollars on the wrong stuff. Are there enough experts? Are there enough educated people for people to get their advice from? Well, maybe not. And that can be one of the problems. But as a consumer, as I said, I think sometimes they just don't care, are prepared to take risks, don't think about it, don't think it'll happen to them, all those things that are common in certain age groups. As we get older, I think we're much more discerning and more focused on our own safety, and we probably are more likely to choose quality over quantity, so to speak.
I would like to think so, but there's still a lot of evidence that it's bamboozling, first of all. There's a lot of contradictory information. And I always think of it like the bad boyfriend effect. Like, he's a bad guy. He's shown you all the red flags, but on you march. And I think the same is
true. And you don't
know
what you don't know. You don't know. You really don't know what you don't know. And that's where, to me, it comes back to practitioners. To me, it's the practitioner's responsibility. Unfortunately, some of them don't know what they don't know either. And that's where it gets a bit scary, because there's no minimum training. There's no minimum training required to inject a syringe of filler into someone's lips. And there's no minimum training required. Now, there's advice and suggestions, but there's no actual qualification needed to do that. So in my opinion, it does come back to the practitioners. I think it's their responsibility to do the best thing for their patient or client. And often the best thing is saying no. Often the best thing is talking about alternate treatment options. Often the best thing is saying, I am not actually skilled enough to do what you need. This is outside my circle of competence, but that will build trust, that will build rapport, and that will actually turn that person into a better clinician with a better clientele and a better business and a better job satisfaction long term. But a lot of people are scared to say no. They either look at, the opportunity of making that sale, so to speak, or else they don't want to let down their, guard of not knowing what they're talking about. And
what about what are some of the safe kind of questions, and what would you recommend to your clients to do, even if you don't have cool sculpting at your practice? What would be the kind of the checklist to go through if you're still interested in having surgical or let's say non-surgical fat reduction?
Yeah, look, I think the first thing is to try and get a recommendation for a practitioner. I think,
From whom?
Preferably somebody or someone you trust, or, a trusted advice. Unfortunately, Google reviews, I mean, I can reel off a list of people I know that, have doctored all their own Google reviews. It's usually pretty obvious if you read through them all these 5-star reviews. I think there's a real red flag to me, and that is time. Okay. So if you go in for a procedure and that practitioner does not sit down and spend some time with you, there's something wrong. And that's, it sounds very vague, but you need time as a practitioner to get to know that person, to understand why they're there, what their expectations are. If I can't meet someone's expectations, there's an unhappy patient, full stop. It doesn't matter whether it was successful or not. If that person thought they were going to get something different or thought you were going to achieve something different, then they're not going to be happy. Whether I think I'm brilliant or not, they won't be. So in order to meet someone's expectations, I really need to know what their expectations are. I need to know where they got them from,
That's
who
really
they got their
interesting.
information
I like
from.
that. Wow.
I need to know why they're really doing it. Is it because they're worried their husband's going to leave them? Are they worried that their friends are doing, better than them or are more successful? Are they, looking at social status? Are they just feeling a bit down in themselves? Are they just someone that appreciates how good you can feel when you look good, you feel good, and it's all about them? And just like buying a nice dress and putting it on, you feel amazing. Cosmetic procedures should be like that. We should be able to do it for ourselves, feel good, look good, feel better, and so on. But you don't know that unless you explore it. And, there are red flags like body dysmorphic disorder and these things that we're taught about to look for. But, that's just one end of the spectrum. There's also this big spectrum of, you need to actually know your patient as well. And you need to know, in my opinion, whether it's a laser, fat reduction, Botox, fillers.
What are Linda Evangelista's options to treat? And, as we were talking about, what are her options now?
Well, so in most cases, this is a procedure that's done on localized problem areas. Okay. So most people who have it done would say, I've got a double chin, I'm not overweight, it annoys me, or I've got love handles, I'm not really overweight. So generally the procedure is recommended for people who are not overweight and have problem areas that are not so much amenable to overall fat reduction, so weight loss. So the problem for Linda, in my understanding, is that she had many areas of the body all treated at once, and so had very widespread problems. And that in itself makes you think, well, why did she have so many areas treated? Was that someone
when I think about my treatment, and I think, imagine having it's not like drinking water. It is a procedure. It's still quite heavy, and you bruise.
And you can see it though. She's famous and she's well known. She's probably experiencing some aging signs that many people do, which often can include, double chin if that's your genetic tendency, and other areas of fat. And she's probably not wanting to do a surgical procedure because she doesn't want the downtime, doesn't want to be recognized, doesn't want to be in a
But I'm
hospital,
just
all those
shocked
sorts
how
of
they
things.
managed to do multiple procedures in one go. I mean, it's quite heavy duty. Like
Yeah.
going back to the consenting and responsible care, it seems a pretty irresponsible thing to have done.
It seems exactly. And that's my point. Like as I said, again, I'm not across the details of the case, but my understanding is that she is suing the manufacturers. And if they were withholding information about that device, which I believe at that point in time it was out and known. So, that's one question, obviously, for the courts. Then the question is, her practitioners, were they completely unaware of that, or did they omit it from her consenting? And why did they treat such huge, like widespread areas of her? Because in most people that wouldn't be appropriate, because if you need every area of your body treated,
Perhaps
or
this is
as
not the
many
treatment
areas,
for you.
then you're not choosing the right option, really.